My name is Dave Rosner. I'll be moderating this portion of the question and answer. I have with me two experts, and Dr. Pasnoor and Dr. Ubogu, and I'll have them introduce themselves. After that, we'll start with the questions and answers.
Hi, I'm Mamatha Pasnoor from neurology at KU at the University of Kansas Medical Center. I'm a neuromuscular specialist here and have been at KU for a number of years, and I take care of patients with neuropathy, and I've been the member of the GBS International Foundation for a few years now, and I'll be answering some of the questions here. Thank you for inviting me to answer these questions here.
Good day. I'm Dr. Ubogu, Professor of Neurology and Neurobiology at University of Alabama at Birmingham. I am a neuromuscular specialist with particular interests in Guillain-Barré syndrome and inflammatory neuropathies. I am a member of the GBS-CIDP Foundation International Medical Advisory Board, and it's my pleasure to be here with you to answer some questions you have pertaining to symptoms related to Guillain-Barré, focused basically on the pain and residual symptoms. So it's a pleasure to be here, and we look forward to informing you about these issues.
All right. Thank you very much, Dr. Pasnoor and Dr. Ubogu. The first questions are for Dr. Pasnoor. Many people with GBS have residual pain levels that vary. Is gabapentin still the best drug for daily use?
That is an excellent question. There are a lot of medications that are available in the market for neuropathic pain, and there haven't been many studies in GBS to say this is the best medication. Again, it depends on individual patient, and there's been a small study looking at whether the gabapentin is better than other the sugar pill, or placebo, what we call as placebo, and trying to see, this was a small study, but it did show that there is some benefit of gabapentin over a placebo. And there have been other medications. However, this has been there in the market for a long time, and if it works for you, it's probably a good medication with less side effects, as it's been in the market for many years. And you've seen that there is no specific study to actually look at different medications to say if this is better than other medications in the market. It has been studied along with opioids to see if you can decrease the use of narcotic with this medication. However, there are no other studies to comparing this with other medications for GBS. As GBS, as you know, is very rare, and it's hard to do a trial like that in GBS patients.
I'm so weary about taking any medications, but the pain really can be extreme. Are there alternative therapies?
So that is a good question again. So then many people ask us in clinic, are there other treatments that we can use and to avoid the side effects of using oral medications? There's no specific study to look at this, but there are a lot of things that go into the extreme when people have pain. Again, there is a lifestyle changes, that would help, would be like physical therapy, occupational therapy may help patients. And there is instead of you taking an oral medications, we have topical creams that can be used for neuropathic pain. And there are, which are, some of them are over the counter and some of them you can get it by prescription if you ask your physicians. And these haven't been studied specifically in GBS, again, because it's a rare condition in Guillain-Barré. However, these have been studied in other conditions that cause neuropathic pain, like diabetes and other nerve pain conditions. And lifestyle modification, like I said, and sometimes pain can be psychologically, it can affect you, cause depression in people. So it's good to have a pain psychologist evaluate you, and get a cognitive behavioral therapy might also help. And TENS unit has been used. There have been other treatments that have been tried, although some of these did not have any benefit compared to the placebo, or the treatments like infrared therapies. And there is TENS unit has also been tried in neuropathic pain, which again, you have to be careful when you use some of these therapies. You have to look at the risk versus benefits, and if it helps you and doesn't cause much risk, then it's okay to try that. And some of the other treatments that have been tried over the years, again, recently you might have heard about the spinal cord stimulator that has been tried in diabetic neuropathy. However, we don't have any data in GBS to say if that would help in the neuropathic pain with GBS, in the Guillain-Barré syndrome. So these are, and acupuncture has also been tried in neuropathy, other types of neuropathy, and that also has shown been some benefit. However, again, these need some larger trials to say that it would be beneficial or not. But there are a lot of other, as I mentioned, topical creams that have been approved for also for diabetic neuropathy, and capsaicin patch has been approved for diabetic neuropathic pain, which can be used in other neuropathies, including neuropathic pain in GBS. However, at this point, we don't have any specific treatment that we know, but definitely physical therapy, just generalized well-being with diet, exercise, I think that's very important. And we see that all the time, that it helps in any neuropathic conditions.
Thank you very much, Doctor. In mild cases of GBS, the strength can come back quickly. How long does the tingling or the pins and needles sensation last? And other than exercise, is there anything else I can do to help?
It's very important to realize, again, proper diet is very important in any neuropathic pain conditions, and exercise, as you already mentioned, is part of it. And usually the maximum improvement occurs within the first 6 months. However, in GBS, we have seen even up to 1 year and even 3 years, they have noticed some improvement. People do have some improvement of symptoms. However, the paresthesias can last many years in some of the GBS patients. There's also been a quality of life and a study looking at the quality of life in patients who have GBS and post-GBS. And some of the predictors that they looked at was, the sleep, the quality of life, and the pain scores, and the GBS disability scores they looked at, and fatigue, sleep fatigue score at 14 days, and that usually predicts how you'll be in at 6 months. So they could be, it depends on how bad your initial symptoms were, that you may have symptoms lasting for longer period, or you may have improvement much faster. About 70% of the patients usually improve in weakness, as we all know, in GBS. So there's a significant number of patients improve. There's 30% of the patients who continue to improve. However, there may be some residual paresthesias for many years.
Very much, Doctor. Next question is also for Dr. Pasnoor. What symptoms or residual handicaps can we anticipate to see long-term?
Thank you. That's a good question. And we just discussed about, long-term, some of the long-term issues. As we mentioned, pain has been a significant issue with most of the patients with GBS. But in addition to pain, as we know, fatigue has been a major issue with major complaint that many patients with GBS talk about. And usually, getting rest and continuing with exercise, or whenever there is fatigue, it's better to take some rest and continue. So this is some of the long-term effects. And again, depending on, like I mentioned earlier, if there's moderate to severe symptoms at the onset, people can have some residual weakness also. It depends on, again, what the initial symptoms were. So like I mentioned, one of the study looking at the quality of life, they looked at, sleep and fatigue, and usually the 14th day disability score and sleep fatigue score looks at that, predicts how the outcome will be in 6 months. So that's one of the things that we have noticed. So these can be like weakness, fatigue, paresthesias. These can be long-term effects, and sleep, as I mentioned, can also be affected in some of them. And some patients have not just the effects of GBS itself, but even the effects of the medications. Medications can itself cause some side effects. And again, drowsiness, excessive daytime drowsiness can occur with many of the medications that people take for the neuropathic pain.
Thank you, Doctor. Next question is also for Dr. Pasnoor. Hand tremors, are they normal? And I've noticed the correlation between anxiety, nervousness, and activity.
So tremor, I would say it's not a common symptoms, but there have been a few reports, like a few case reports actually in literature, and one of them was from 2019 by Dr. Halter's group. They in Netherlands have presented like 3 cases of tremors in the course of GBS. So there is just like we see that more in the chronic form, that's the CIDP. However, in GBS, it's not that common to see that, but there have been a few case reports that reported hand tremors. Again, I think anxiety and nervousness can usually cause tremors in even in normal people, and if you already have tremors, that can definitely get worse with anxiety or nervousness if you have associated tremors.
Thank you very much, Dr. Pasnoor. All right, now we're going to move on to Dr. Ubogu. All right. This question is for Dr. Ubogu. Pain and fatigue. What are the current and future therapies on the horizon?
Thank you for the question. This is a major challenge in the Guillain-Barré field because unfortunately, we don't have any specific therapies for pain and fatigue in Guillain-Barré syndrome. The current thinking is that residual production of a group of proteins called cytokines, contributes to chronic pain and the fatigue. Unfortunately, this is a major area of lack of information within the field. There are a lot of investigators looking into means of understanding chronic pain, the different mechanisms that are involved in transition from acute pain to chronic pain, and the effects of residual nerve injury and chronic pain. So it's unfortunately a major area of lack of information in the field. So it's definitely important as we move forward and try to understand Guillain-Barré and other inflammatory neuropathies that more work is done to understand why patients develop chronic pain, why they have chronic fatigue, and what kind of research efforts can be put together in order to better understand this in the patient population.
This question is for Dr. Ubogu. I experienced chronic brain fog with memory loss. Is there anything I can do to help this?
So with Guillain-Barré syndrome, it's a disorder of the peripheral nervous system. But one can imagine with a significant disorder of the peripheral nervous system, many times when patients are actually sick and hospitalized for periods of time, the other, metabolic abnormalities do take place. So unfortunately, we don't have any specific treatments for chronic brain fog. However, it's important that patients, do work with, the relatives with their loved ones, and really, try and come up with a new normal. A healthy diet definitely helps. Exercise definitely helps with memory function. Making sure that the vitamins B1, B12 are normal, and and then having good rest. There's a good correlation between insomnia or lack of proper sleep and brain fog or forgetfulness. So those kind of activities, exercise, good sleep, good diet, interaction with family and friends and loved ones, and of course, lifestyle modifications can help with that process.
Thank you very much, Doctor. This question is for Dr. Ubogu. Can fatigue, brain fog, lightheadedness, dizziness persist even after years of IVIG and improvement in walking?
Unfortunately, yes, they can. The main focus many times in the treatment of Guillain-Barré patients has been on improvement in motor activity or improved strength. However, Guillain-Barré syndrome can affect the autonomic nervous system. And with any disorder involving the peripheral nervous system, you may have residual injury to the nerves. And the autonomic nervous system can still remain deficient, even though effective treatment in terms of motor function has been obtained with IVIG. So those are symptoms that can persist, and many times those are the forgotten symptoms because our emphasis for many years has been on motor improvement. So yes, those are things that can persist in patients with Guillain-Barré, and it's important for not just the patient, but also the healthcare providers to recognize that these persistent symptoms can affect quality of life and come up with strategies to mitigate the effects on daily activities.
Thank you very much, Doctor. This question is for Dr. Ubogu. Some people have trigger fingers, fingers that get stuck in a bent position. Is there anything that can be done to help?
Many times with trigger fingers, the best solution is surgical fixation, where the tendons that are tightened can be released. However, it's important that surgery is done by someone who's experienced with it, because there's a difference between the trigger finger and a contracture. A contracture where there's no movement whatsoever due to tightening of the tendons could be a problem in terms of recovery, because many times the blood supply to tendons isn't very good. However, if it's a trigger finger, that will involve releasing of the capsule around the joint, and that could actually significantly improve symptoms. So it's very important that a distinction is made between the trigger finger and a contracture. And if one wants to pursue surgical fixation, it's done by an experienced hand surgeon who deals with patients with neuropathies.
Thank you, Doctor. This is for Dr. Ubogu. Are there any special diets to help those with pain and inflammation?
I wouldn't say there's a specific diet. I mean, you see a lot of adverts about antioxidants and different supplements out there that's supposed to help with pain, or you see adverts where a lot of vitamin B12 or B1 and B6 at very high levels are recommended. In general, I'll say a good, balanced, healthy diet it could be useful. Being well hydrated definitely is a good thing, and really having a diet that maybe a multivitamin, making sure that your vitamin status is good can help. There isn't a specific diet for inflammation, anti-inflammatory diet, but in general, one could eat foods that are rich in antioxidants, not only for the sake of potential, at least for the sake of inflammation, but just for overall good health.
Thank you very much, Doctor. That's the end of the questions that we have for today, and I'd like to thank Dr. Pasnoor and Dr. Ubogu for their expertise, their time, and their valuable suggestions that they've given us today. Thank you very much, both. I would like to add one other thing as somebody who has, I have CIDP actually. And one of the things that I find the most is keeping a positive attitude. I have met amazing people through the GBS-CIDP Foundation. I sit on the board of directors. And the people who have all sorts of varying degrees of ability. Some in wheelchairs, some have use of right hands, left hands, everything. But the one thing that they have all in common is that they have not allowed their diseases, whether it's GBS, CIDP, MM, anything, to define them. They have, in fact, changed their expectations of themselves, and they lead amazing lives. And their spirits are absolutely incredible. So having a positive attitude is I don't want to say it's better than the medicine, because it certainly isn't, but it's certainly right up there. So keep your positive attitude. If you have someone who's helping you through this, whether you want to call them caretakers or whatever you want to call them, and they're helping you, give them a big hug, because they deserve it.